So you know that male aesthetics is a hot topic. I did a lecture yesterday. Talking about the trends in male aesthetics, and I'm really glad to have a very good friend of mine here. He looks very dapper, that suit. I almost wore blue today, but today I'm in my black. So I'm excited to have you here. A very experienced surgeon, great person, Gregory Mueller from Beverly Hills, and he has some really specialized techniques. But today we're going to talk about what men want, especially in aesthetics, because he treats a significant amount of men in your practice. Talk to us about that.
Yeah, I went into practice 20 years ago, and as a plastic surgeon until 3 years ago, I just offered surgery. And then I realized in order to really address the needs of patients, I needed to sort of expand my horizon. So I added lots of minimally invasive sort of approaches for men.
So tell viewers who don't do a lot, because we're in a place where everyone's in aesthetics.
Sure.
You did surgical and non-surgical, and what has become popular over the past few years, you were saying you brought in these minimally invasive procedures.
Yes.
What is that? What does that mean?
Yeah, sure. So as a plastic surgeon, prior to 3 years ago, I just did surgery. So if someone came in, it was either surgery or I would refer them to someone else. Then I realized people aren't coming in asking for surgery, they're asking to look better.
Got it.
So over the last 3 years, I've added laser technology. I use pro-yellow laser for sun damage. I also use Vanquish to help people sort of sculpt the body non-surgically. That's a radiofrequency device. And then also Exilis Ultra, which is great to kind of tighten and tone the skin, and microneedling.
So that's interesting. So, you have a plastic surgeon here who was doing all surgery all the time, which is basically cutting and has downtime. And the trend that he saw was to use devices that people wanted to not have any cutting or downtime just to get an improvement. How is that complementing now? What did that do to your surgical practice?
Yeah, at first I thought it was going to be sort of a trade-off. I'd have to sort of choose minimally invasive and do less surgery, but in reality, it's added. It's added to everything because now when patients come in, I build a relationship with them. They stay in the practice. We can offer everything from A to Z. So it's a more comprehensive sort of program that we offer now, which is much better.
That's great. And I know one of the big areas for you in terms of your surgery is the neck area.
I love the neck.
Let's talk about the neck. So here, tell everybody, because they might not know about your specialized technique. I know you very well.
Okay.
But tell them, because I would love for them to know, so we can kind of talk about the surgical aspect, which you do, which is somewhat non-surgical even, versus what is available without any cutting. So let's hear what his specialized technique is for the neck.
Sure. So in 2006, I came up with the concept of being able to sew the neck muscles underneath the neck without opening the neck. I felt like the surgery was very invasive for someone who had some banding under the neck or some glands that were visible. So I came up with a kit that uses a lighted needle, and the thread's attached to the middle of the needle, and the doctor just passes this needle underneath the skin and can see the light coming through the skin. The surgical kit is called the ICLED Surgical System, but we perform a procedure called Elevate, and it lifts the back part of the neck, so it lifts the glands and the muscles here at the back part of the neck, so it's a real great complement to, with liposuction or skin tightening technology.
Which is great because a lot of what he was describing was in the past, the doctors were only able to they had to make a cut either under the chin or by the ear to kind of go under the skin, tighten the muscle, and pull everything back. That was pretty invasive. The technology that he developed was using a needle that has sutures or threads on them to lift, creating a scaffold under the skin and lifting the skin without much downtime. That is becoming very popular right now.
Yeah.
And even a little less invasive, the ones that I do, more of the internal threading, are becoming super popular. Why do you think that's occurred?
I think it's the market. I think it's what people want. People don't want to have big incisions and a lot of downtime. People want to be able to get back to work, and they don't want any visible signs of a surgery.
Well, and that's actually what I wanted to bring up, was my leading question to you. Do you feel more men are inclined to want those? Because without having hair to cover scars can be very visible in a male if they've had a facelift, especially if you were to go up into the hairline or around the hair and move it around. Sometimes it's very obvious that a man had surgery.
Oh, absolutely. And men, when they come in, I mean, their biggest concern is, you know, they don't want to have visible scars. And a lot of men, because of the muscle mass that we have and extra soft tissue, the neck is their primary area of concern.
Yeah, I feel like the under eyes and the neck in men are the two places they see aging very early. And then if their family has a lot of laxity and hooding in the eye area, you can have guys in their 20s where their eyebrows are like making it so they can't even see.
Yeah, oh, and, absolutely.
You know, so that's where it's interesting being a surgeon. You have the ability now to not only do a mix of surgery and or non-invasive, or even somewhere in between, which we didn't really have before.
Oh, absolutely. I mean, I went into practice 20 years ago, and when I went into practice, it was either surgery or no surgery. But now, with all of these other tools, we can absolutely, you know, do a sort of a lower eyelid lift without surgery. And then later on down the road, they may need a surgical procedure, but it's a great way to make people happy. Yeah,
and some of the laser technologies even tighten the skin. I've been using one now called Renuvion for a while, which is a little bit more of an aggressive radiofrequency resurfacing technology, but the craziest thing I've ever seen from it is the tightening effect that it gives patients. Yes, it has much more downtime, but it can tighten the under eye to a point where you don't ever need to cut the lower lid, which has a potential, if you guys don't understand, the lower lid area is a very sort of dangerous area to where if you do surgery there, it can pull the eyelid down. It can cause some issues. So doctors always want to try to avoid cutting in that area, and we have a plastic surgeon here obviously is trying to do other things like lasers and skin tightening and or threads to kind of lift that area. What I wanted to ask you is, what is your hottest treatments for men in your practice? I know you mentioned a few, but those were also body. So I'm kind of curious, you know, of face and body, what do you think are the hottest treatments?
I think, you know, for me, just because of my technique for the neck is the number one reason people come to see me. Yeah. So that would be my number one procedure. But I would say microneedling for men, which you would think men would not care that much about the texture of their skin, but I was definitely wrong about that one. It's a huge, huge winner in my practice.
Yeah, that's what I figured. You know, it's interesting. Men, I think, in the past never wanted to have these daily routines. They didn't want to come every month to go to the doctor, but once they start to see the improvement, you get them on skincare, you start light things like microneedling, facials, simple peels. I'm a dermatologist, obviously do all these skin combinations. They start to see that sun damage is reversed. Their wives, their partners tell them they look a lot better and less tired. And at work, they're just doing better because they feel better about themselves. They want to come in. And one of the gateway treatments, I feel like, besides we've talked about Botox all the time for men as being kind of a gateway for cosmetics, but now it's actually, I think, less of an injectable and more of a topical sort of mildly invasive treatment like microneedling. Microneedling was out of favor. People did this many years ago before lasers existed, and was out of favor until recently when a lot of the pens came on the market for doctors to be able to do larger depths for scarring, for stretch marks. Now we're doing it in combinations with lasers. So for example, you talked about yellow laser. I think that's a great photo rejuvenation laser. It could treat melasma, sun damage, and specifically vascular lesions like rosacea and dilated blood vessels. But you combine that with the microneedling for texture, for tightening, for fine lines, you have a very simple procedure in a treatment where they're just red for a day. What man wouldn't want to look better with only have mild redness for a day?
Oh, absolutely. And we combine them very often, and the men love them.
Yeah.
Absolutely, because no downtime.
That's exactly right. So I feel like that's a great. And so my question to you for the neck area, because I always am curious, you are the innovator of treatment in the neck. Where are we going? Where are we going? Are we ever going to get to a place where you don't have to cut?
Yeah. No, it's such a good question. So today we have technologies that will tighten the skin, whether it's laser technology, which I use Smart Lipo for 7 years.
That's what I was going to talk to you
or
about.
Something like FaceTite, which is a radiofrequency technology that I just acquired, so I'm excited to get started on that. So we have technologies that will tighten the skin. We have technologies that will dissolve fat, things like Kybella, liposuction, different, Thermiva, those sorts of technologies. But where we are going now is there's nothing really that will address the glands and the muscles underneath. So that's the challenge, and that's the technique that I came up with, a way to suspend all of that in a very long-term sort of result area. So that's sort of the area with the neck.
That's actually a good thing, I think, to talk to viewers about. So you can't change your underlying anatomy If you don't have a good bone structure, you need an implant, or they need to break the bone and replace it and move it around. If you have very, very large glands in the neck, you can lift the skin all you want and remove the fat. You're still going to look like you have wide and you have some puffiness there. So this technique he's talking about, where he suspends the skin with sutures, can also suspend the glands, which is very safe for people, because in the past the only treatment was to surgically remove them. And what's the issue with that?
Yeah, the problem with that is there's a high risk of nerve damage, bleeding, and then also dryness of the mouth, which is not a good thing.
Permanent long-term complications, which people really just don't want.
Yeah, exactly.
So we know that the trends are going to be these sort of minimally invasive small procedures to try and lift and tighten these areas. And that was the next thing I wanted to talk to you about, was the internal tightening.
Yes.
So we went from liposuction to kind of remove fat and help tighten the skin. Then people went liposuction, adding some heat.
Yes.
That was smart lipo.
Yes.
So now my question is, what are you going to do? Because you were the smart lipo, internal heating, tightening the neck. What are you going to do now that we have FaceTite and Renuvion?
Yeah. So I'm gonna, my technology that I've just acquired is FaceTite. I'm very excited about it. I love radio frequency. I believe in the science. So I will be combining that with the Elevate procedure to lift the glands and the muscles. So I'll be treating the skin by tightening it through a tiny little puncture as opposed to incisions, and then dissolving the fat or removing it with a little bit of liposuction. That's going to be my combination approach.
That's a that's a minimally invasive combination of internal heating, suspension of tissue, and if you wanted to get fancy, you could do some external lasering and tightening and stuff for crepiness and for other sun damage, etc., to get a really full neck rejuvenation.
Absolutely.
What are you gonna call that? That's what I want to know, because you're gonna be the man of a trademark. I already know it.
All right. Well, thanks. We currently call it the Elevate procedure,
Yeah.
but we definitely need to come up with a combination name for all three technologies. Absolutely.
Well,
one thing that I liked was when you and I did a case together, I love the fat grafting that you did along the mandibular border. I think that's an area too. You asked me about the neck earlier. That's something that we really have to look at, because in men you want that strong mandibular angle and the jawline.
Yeah, because the big thing I noticed was, everyone was focused on the neck and then they don't look at the underlying anatomy. And if you don't have that structure there, the neck is unsupported.
Yes.
So if you do an implant or you do fat grafting or even some permanent filler, you can get a nice contour, and the elevation makes them look younger much longer.
Yes, absolutely.
Well, Dr. Mueller, I appreciate it. You're one of the best, and I look forward to seeing what you're gonna come up with as we go forward with these advanced technologies. So thank you for
Thank you
for coming.